Hey everybody, good morning or afternoon, depending on where you may be joining us. My name is Matt, and I wanted to say first off, thanks so much for spending your time with us today. If you could please just chime in on the questions tab of your control panel, just so I know you can hear me all right. And as soon as I see a couple of those, we'll start moving along. But I do just again want to say thanks so much for opening our emails and signing up for our webinars. It's really a pleasure to have you here and spending your hour with us today. So looks like people can hear me all right, so we'll move right along. So today's topic per request is how to develop an SIU that is effective, dynamic, and audit ready at your organization. And we've got a great presenter for you today. Dave, who is currently our Director of Marketing here at ProviderTrust, but was previously the head of our health plan department here at ProviderTrust, has worked with tons of SIU departments to help improve their processes and really just make the organization better as a whole. I'll let him talk a little more to that here in just a second. But this is who you will be hearing from today, and a little bit about us. We are a software as a service company here in Nashville, Tennessee. We work with health plans as well as provider organizations and all departments, and just helping them improve their processes so they can focus on their people and what's really important to their role in their organization. So that's a quick bit about us. Our webinars, if this is your first one, I'm so glad you're here, and if this isn't, I'm glad you are a repeat attender. So these are our upcoming webinars, specifically on the health plan track. We have May 15th, we have a review of the first 5 months of the CMS preclusion list that we're excited to talk about. And all of these webinars are for CEUs. So if you are on the call today, be on the lookout for this afternoon. You'll receive a copy of these slides and a recording, and then just be on the lookout via email. We will send out that CEU certificate shortly. So thanks for being here. We'll share that with you over the next few days. So a little bit about today's agenda. We will start with the SIU, an overview, then move on to building an effective SIU, what you can do at your organization to ensure that, how to design an effective workflow, and then we will move to data mining runways for SIU, and then finally we will close with a case study to kind of show you guys how to implement and how this may work at your organization. So with that, I want to open it up to just learn a little bit more about who we may have on the call. So if you don't see your department here, please just chime in on the in the questions tab of your control panel, just because we can only provide 5 options, and I know that is a lot more. There are a lot more options there. So if you aren't in one of those departments, please just chime in there and let us know who may be on the call. And we'll have a few polls throughout this presentation, and we'll launch them and then share some results so you guys can get a feel for who your peers on the call as well. So we'll go ahead and close that. Great, looks like it's exactly who, well, we're happy everyone's on the call, but this is great to see. We have SIU and compliance folks. So you're in the right place, and we are happy to talk to you about some of this stuff. So with that, I will pass on to Dave to kick us off.
Awesome, thanks, Matt. So excited to have everybody on the call today. Just a few quick housekeeping things before we jump in and get rolling. Please feel free to ask any questions throughout the presentation. So on your GoToWebinar control panel, you can type in anything some of you guys already have. We will hold all questions, and we'll certainly get to everybody at the end. If we can't get to your question today for sake of time, we will follow up today or tomorrow and just get you an answer. So please feel free, ask away if anything comes up throughout the presentation. Just a couple quick notes about today's session. We had several of our team members that we work with, or our clients, I should say, that we work with in SIU teams, as well as compliance teams from health plans, reach out and say, hey, we'd love a session on just what are best practices in developing an SIU, and then specific to some of the things that that relate to the core elements of building an effective SIU. How do we improve? How do we get better? What are resources that we can go look at to build out our team and build out our department? Couple quick things on building. When we talk about building a department or building an SIU that's effective, dynamic, and audit ready, there's two elements to that really. There's people and then there's process. People in terms of recruiting, retention, how do you source the right types of investigative minds that can actually join into your department and really complement your team really well. And then there's the process. So what is it that we're actually doing just on an from a systems perspective, from an infrastructure perspective, what are the processes that are making our SIU just tick? Today, we are starting with the process side of that. So this is sort of part one in a two-part series. Part one that we're focusing on is structuring your SIU and developing out your department, developing out your process. Part two of that, which will come in a later month, would be how do you actually recruit and retain the right people for your SIU team. So just know that that's coming, but we're not gonna focus there today. Where we are gonna focus on is how do you build an effective process. So with that, let's get into this. So a couple of this, for some people that are on SIU, we know about, the 26% of you or so are from an SIU, and then more of you are from compliance. So I wanted to give a quick overview of the problems that SIU solves. So for some of you in SIU, the next slide or two may seem a little elementary, but for some of you in compliance, it's probably good news to at least anchor us to a baseline before we go through and go to next steps about how to actually build this out. So the national problem, right? National healthcare fraud, waste, and abuse is a nationwide problem. Estimates show, and we've got a ton of data on this, that show from anywhere between 3 to 10% of the nation's healthcare spending can be attributed to healthcare fraud. Some of the most common examples of that fraud include, and there's so many of these, but here's just 4 that tend to come up all the time as we work with SIU teams, which are phantom billing for unnecessary tests or procedures that were never performed, upcoding or billing for more expensive supplies or procedures than were actually ordered or performed, excessive billing for more than 24 hours of services in one day, and fake billing companies such as phony pharmacies that disappear after collecting reimbursement. We actually see this all the time. We work with not just providers for health plans, but we work with a lot of vendor companies for health plans as well. And this is a trend that we see in the industry just happening all the time too. So structuring the SIU as a solve. First, when we think about what SIU actually does, every SIU should have a mission and a vision that is written, published, and known. What are the roles of that SIU within the organization, and then what are the internal and external needs and resources to actually accomplish what the goal is for the SIU at your organization. We have a saying here at ProviderTrust where if you've seen one healthcare organization, you've seen one. The same is true for SIU teams as well. If you've seen one SIU team, you've seen one. Everyone structures their mission and vision a little bit differently, and roles of the SIU team really change, but we're going to anchor to some best practices about how to actually build that. And then important considerations that if you're in SIU or you're working with an SIU team, is where does SIU reside within your organization? Does SIU have influence over some prepay processes, or is it mostly on the post-pay? It's mostly on the investigative. How does SIU relate to your communications and your marketing department? Does that messaging that's so important for SIU to communicate, is that actually getting transmitted internally and externally? Who has oversight to SIU and where does that reside? What lines of businesses are impacted by SIU and any regulatory requirements? And we'll go through what some of those are too. And the last sort of intro slide, which is next, is a collaborative SIU, right? So building partnerships is critical to developing an effective SIU. Here are just some of the departments that we know SIU teams are working with on an ongoing basis that you see on your screen, right? So provider relations, provider contracting, credentialing, legal, finance, regulatory, markets, government affairs, and I won't read them all. You can read them on the screen. Some of the ones that I'll focus on a little bit today are certainly in provider relations and contracting and credentialing, and how do you connect some of the activity in those departments, and also marketing and communications, and how do you communicate effectively internally and externally, what the vision is, ongoing training and documentation, and what does that look like, and how do you really just partner with the teams in your organization that you need. So with that, we'll do one more poll, and then we'll get into some of the meat of this. So which department does your team most closely work with? And so this is a little intentionally ambiguous, just to get, again, a flavor for who's on the call today. We know that largely this is a compliance and an SIU audience, but which of the teams are you guys actually working most with? So if you're in compliance, do you work with SIU? Or if you're in SIU, do you work with claims more often? And this will give us a really interesting flavor for, are people in SIU more likely to work with compliance, or do they more likely to work with their claims team? Or are they more likely to work with credentialing on the front end? So just an interesting flavor to kind of how this plays out. And it'll be really interesting to see, we'll give it another minute or two, knowing that this audience is it is exclusively compliance and SIU folks from health plans across the country. It'll be interesting to see who everybody works most closely with. So we'll give it another minute or two. Looks like we're at about 85% of everybody voting so far, which is pretty good. So just another minute or two, we'll go home and share the results. And so again, fascinating, right? So from an exclusively compliance and SIU audience, we really see these departments across the board. So the majority of you are working with claims. About 40% of you are working with claims the most. Compliance is a number two, so I'm sure this is the SIU folks working with compliance on a regular basis. And then interestingly, that the compliance folks are not always working with SIU, they're kind of working across the gamut, right? So provider relations, credentialing, and SIU as well, kind of rounding that out. So super interesting, just to get a flavor of kind of who's on the call. So as we continue on with SIU teams, structuring effective communication. So this is where some of the marketing stuff comes into play. Really, there's three pillars to this, just effective communications. There's internal communications for SIU teams. There are external communications for SIU teams. And then there's the hotline, which is just a way to source kind of what's going on that's both internal and external. So from an internal perspective, this is super critical. Organization branding, just website consistency, memos, internal communication channels. How is SIU sharing the important things that need to happen within an organization back to their own organization? What's the most effective way to achieve that? And then I would challenge everybody on this call that's in an SIU to partner with your marketing team to figure out how do you make this branded in such a way that actually drives it drives validity, and it drives the sense of this looks and feels like your organization. We've got tons of data, and again, I'm now in a marketing type role after my background in working with health plans on more of a consultative basis. But now working with marketing, that health plan communications and what that looks like, this is super critical to get right on an internal basis. So I would strongly suggest working with your marketing department to figure this out. External communications. This is going to be some stuff that is probably new to most people on the phone. Member handbooks and provider handbooks certainly aren't new, but how do you make them look and feel and contain the actual information that you would need? Websites and microsite experiences. This is a new trend that we have seen SIU teams start to deploy as they're trying to educate the consumer base on sort of how do we work to protect our members and protect their patients? How do you design that in such a way that drives your vision, your mission, and is present throughout your whole organization? That is something that we've seen really strong SIU teams deploy. Again, partnering with their marketing department, but being able to roll that out pretty effectively. Letters, certainly there's no secret there. That always works. And then SEO and SEM and social media. And I say this in a different type of way. For those that aren't familiar on the call, search engine optimization is what SEO stands for, and search engine marketing. So how do you make sure that when people are searching for your organization and trying to find information about some of your SIU, activities, that it's popping up first on Google, right? This is something that certainly we pay attention to when we're trying to find how effective SIU teams can communicate with the marketplace or with their member population. This is a tactic that would strongly recommend deploying in external communications. And then a hotline. We'd recommend certainly 24/7 hotline access, always anonymous and web-based as well. And then either internal, if you have the resources to support that, or an external vendor would be a really good way to partner and do that. So then trainings, internal versus external, right? Two examples of all of these. And the bottom point I'll make first, and then I'll go into some of the specifics on these, is ensure you are accurately tracking, measuring, and reporting progress on each training priority, regardless of whether it's external and internal. So external trainings typically focus on this list of items on the left: contractual requirements, False Claims Act, reporting mechanisms, vendor monitoring and compliance, provider monitoring and compliance, Deficit Reduction Act, and tracking and monitoring of success, ROI, and recoveries. Examples of internal trainings: training for SIU employees, right? Onboarding, continuing education, fraud, waste, and abuse training at hire or annually, contractor, FDR, vendor compliance training, the False Claims Act, program integrity compliance, ongoing communications via internal channels, and reporting mechanisms and workflows as well. So the best SIU teams are consistently tracking and measuring and reporting progress on each of these for internal and external channels. And then last thing before we get into some of the specifics around the compliance side of things is regulation and compliance. So ensuring your SIU team is current on updates from each of these sources of regulations imperative, right? You see the list here, some of the examples: federal statutes, regulations governing Medicare Advantage plans, the Medicaid Managed Care Manual, the Medicare Managed Care Manual, state contracts and any amendments, state statutes and regulations, CMS guidance, and each of these sources carries penalties for noncompliance. And so when we talk about that, we're going to spend just a second on each of those major 6 things and saying, here is what the actual regulation says, here are the penalties, and here's specific examples to be aware of. And I'm hoping that this will help connect the dots for those that don't work in SIU, and for those that do work in SIU, this is something that you can take back to your organization and potentially even share out, right? So I don't remember if Matt mentioned this at the beginning, but you will be getting a copy of these slides, so you can certainly use them in some of your ongoing training as well, just to educate your own workforce in terms of what the best SIU teams are help preparing for. So the first one, criminal fraud statutes. Right, these are essentially knowing and willful compliance violations. Depending on severity, they can essentially cause your company to violate several general criminal statutes that make it a felony to defraud Medicare, Medicaid. It's punished differently. So example of some of these, right, submission of false claims, mail fraud, wire fraud, healthcare fraud, obstruction of justice. Penalties, you can see this is criminal, right? So large criminal fines and penalties, prison sentences of up to 20 years for individuals. And examples of these are making false submissions to a state for kick payments, falsifying reports of costs submitted to states to increase premium payments from members, or upcoding encounter data for higher risk adjusted member premiums. The second one, False Claims Act. So again, the regulation source for the False Claims Act are both federal and state. Penalties for this is treble damages, so up to 3 times the amount of damages sustained by the government because of the fraud, and then an additional penalty of between $5,500 and $11,000 per false claim submitted is a federal penalty. And so 2 examples of this: submitting a bid package that contains false data in order to receive a higher rate, certifying the accuracy of a reconciliation report, knowing that the data are inaccurate to avoid having to repay overpayments. Third one out of 6, so we're halfway there, and then we'll get into actually designing your SIU workflow and infrastructure. CMS intermediate sanctions. So sanctions may be imposed by CMS for the following: misrepresenting information that it furnishes to CMS to an enrollee or to a provider, failing to provide medically necessary items and services to its members, discriminating among enrollees on the basis of their health status and violating marketing rules, right? Why it's so important to partner with your marketing department whenever you can. Penalties of this is suspension of your company's ability to enroll in its beneficiaries in its Medicare plans, monetary fines, and potential termination of Medicare contracts. And examples of these would be purposely disenrolling members from a plan based on health status, purposely denying covered health services for members. Number 4 out of 6 is anti-kickback statutes. So again, regulation sources for these are both federal and state. States have their own anti-kickback statutes. Penalties are fines of up to $25,000 per violation, a felony conviction, and up to 5 years in prison. Additional civil penalties of up to $50,000 for each violation, plus up to 3 times the amount, the total amount of remuneration, and then a potential exclusion as well at either a federal or state level. And there are 44 different exclusion lists as well. And examples of this would be providing gifts or cash incentives to members in exchange for enrollment, paying physician offices for enrolling patients in your health plans, and accepting payments from vendors in exchange for using services. Number 4 out of 6 is very well here at ProviderTrust. Regulation source, federal exclusion from healthcare programs. There are 2 federal sources for exclusions, which are the OIG-LEIE and the SAM-GSA. And then state Medicaid exclusion lists. So there are 42 publicly available state Medicaid exclusion lists as well. The most recent of those being Colorado, which just became public just a few short weeks ago. Penalties of an exclusion is suspension of your company's ability to bill or receive any reimbursement from Medicare, Medicaid. If your company has discovered that an associate is excluded, the associate's employment should be terminated. And then examples of this, right? Again, an associate's conviction for healthcare fraud requires the OIG to exclude that person from participation in federal healthcare programs, and then determining if your company will terminate the associate once he or she is excluded. And then the last one is just CMP law. So again, regulation sources, the Office of Inspector General. Penalties, fines of up to $50,000 per violation. Treble damages, 3 times the amount claimed, or 3 times the value of each bribe in the case of a kickback. And then examples of these are refusing to enroll a Medicare recipient due to the individual's health status, or hiring an associate who has previously been excluded from participating in federal healthcare programs. So now, designing your SIU workflow. Now that we kind of have a similar framework of understanding about what does an SIU do and how does it exist, and sort of what regulations to pay attention to within an SIU, how do you design the infrastructure that's actually going to help you manage your team well and make sure you're properly allocating resources from your organization. So again, our 3rd out of 4th poll question, just to keep you all engaged as y'all are here today, is which department at your health plan handles ongoing provider network monitoring, right? This is something that we're going to talk about pretty specifically as we go in, being what some people would consider an SIU function, but there's a lot of functions that don't consider this part of SIU. Some of them consider it a compliance function, some of them consider it a credentialing function, some consider it a function of provider relations, and certainly a few of them consider it a claims function as well. So we're getting pretty good engagement on this. Again, just another couple minutes. This is super insightful to see. And hopefully we'll give you a flavor as we'll get into provider data and how the SIU team sort of partners with provider data as well. Another minute or two. I should really just say second or two. We'll go ahead and close it out and then share the results on the screen. So again, it's a really interesting mix here. So about 30% of y'all, the credentialing department handles ongoing provider data monitoring. 40% it's handled in provider relations, about 10% in SIU, 17% in compliance, and 3% in claims. So again, it's really interesting to see. We've got quite a few people on this webinar today, so it's a pretty good mix across health plans, really across the country. So it's interesting to see sort of who does what where. So with that, continuing on is understanding the infrastructure of what best-in-class SIU teams are doing. There's really four things, right? So it's developing your anti-fraud plan, but really what that means is identifying your case management system. How are you managing your cases within an SIU, and how is that a known and integratable system that you can have other systems within your organization that actually can feed data in and out based on how to open up a case, right? So a really good example, if you have an excluded provider come up within your ongoing monitoring, how is that fed into your case management system so that you can track the recovery of those claims, right? And certainly we've seen health plans that do this from a homegrown standpoint, but also using a vendor product as well. There's no right or wrong answer, but I would certainly suggest as healthcare becomes more technical from a systems perspective, making sure whatever system you're using is built in such a way so that integrations can happen pretty seamlessly within the systems that you use and love today. The third one is developing policies and procedures. So this is very standard. Everyone on the call, I'm sure, is doing this. But policies and procedures from case intake, triage, and case prioritization. We'll actually show you an example of that as well. Case referrals to regulators, time requirements, conducting reactive or proactive investigations, case referrals to regulators or law enforcement, remedial actions or reporting. Just a few of what are your written policies and procedures that from onboarding, anybody in your organization can understand what's the process within your SIU team that's known, and it's not something that needs to be on the fly. In terms of becoming audit ready, this is sort of the gold standard, right? So making sure everything is written, followed, and certainly adhered to be audit ready. And then the last one here is proactive data analysis and monitoring. So this is some of the stuff that we partner with health plans, but super imperative to make sure that whatever department is handling your provider data monitoring and analysis is including ongoing, if not daily, exclusion screening, sanction screening, credential verification, not just at every 3-year recred period, but certainly something that's a little bit more continuous than that. NPI validation and pulling data directly from NPES, and then searching things like Medicare opt-out as well, and making sure that that's incorporated into that. And so I mentioned case prioritization. The best SIU teams that we've seen have a very clear and also super simple way to triage and prioritize any matter that comes through and give it a priority, so that within your case management system, it's very easy to see which are the high priority cases and which are the low priority cases, especially at a board level. If your SIU has a presence at the board level, being able to very easily showcase what's important and what's not. So here's an example of a prioritization matrix. This is actually directly from one of our partner health plans. They were willing to let us present it and kind of tweak it a little bit to be able to send it out. But sort of a high, medium, low, and what actually qualifies in that. So high prioritization, cases or allegations having the greatest program impact, which would include patient abuse or harm, multi-state fraud, high dollar impact of potential overpayment, and that is high dollar is set by you and your organization. Likelihood for an increase in the amount of fraud or enlargement of a pattern, and cases with an active payment suspension, right? So that's just an example of what one partner health plan would qualify as a high priority case within their management platform. Medium priority, cases or allegations not at the level of a high priority, may be a case active with law enforcement or regulatory agency and SIU told to stand down. Cases in recovery status, multiple complaints against subject but lower dollars involved, etc. And then low, cases or allegations not at the level of a higher medium priority, may be low dollars involved and had no or few prior complaints. All cases being prepared for closure at this health plan should be a low priority. Right, so just a quick example of what that could look like. And then based on that, the actual investigative action taken, right? So the SIU actions to either corroborate the allegations or determine them unfounded should include, but not be limited to, and everything you see listed here, right? I'll read just a few. Conduct data analysis to identify outlier billing patterns, public record reviews, state licensure, state disciplinary actions, corporation records, etc., partnership system search, a fraud prevention partnership, pull a valid random sample based on the allegation, right? So a top code build, claims with excessive codes, things like that. And then the last piece before we get into data mining specifically and how that can be deployed is really the 7 steps of tracking and measuring success. We would highly recommend, and the best SIU teams do this really well, having a dashboard that incorporates all 7 of these elements in some way, shape, or form. So communication and collaboration, documentation in a way to quickly access primary source verification documents, ensuring data integrity and actually assigning a score to your data integrity, return on investment, really. So from a recovery standpoint, how successful are you in actually bringing in those recoveries from overpayments? Staying current, what new legislation is actually impacting the way your SIU team is operating. Transparency, making sure everybody understands where exactly you are at in all of your cases, and that's dashboard viewable. And then a reevaluation, just an ongoing, how often are we looking at this, looking at these metrics, pivoting the way we're measuring things and what's being successful or not. So the best SIU teams incorporate all 7 of these things into one SIU dashboard that can be shared up or down, right? So down to your newest hire, your newest investigator, and upwards even all the way to the board level for complete transparency across your SIU department. So continuing on, data mining and analytics for SIU teams. And here's where we'll get into a case study in a second about what this means and what this looks like, but this is runway for SIU teams. The best SIU teams are incorporating data mining on a large scale into their ongoing processes. And so when I say future data mining runway, here's really what I mean and what the best SIU teams are doing. So provider data accuracy, we know that's a huge pain point. We did a webinar about this 2 months ago where we went through all of the results from the CMS 3-year audit of provider directory accuracy of Medicare Advantage plans. And sort of what they found. Largely, about 1 in 2 provider directory records are inaccurate. They have some sort of inaccuracy. And happy to pass that data along to you guys as well in video format or webinar format. Just send us a comment if you're looking for that. So we won't get into it today. Provider data mapping, right? So do you have a mapping process in place for provider data that incorporates things like former names, different NPI numbers or associated NPI numbers, billing companies that this provider is associated with, whether it's that entity or whether it's other individuals? Do you have a process in place for this from a data mining perspective? This is where the industry is going for SIU teams. The best SIU teams are leveraging data mining and then deploying it in different work streams to actually prevent things like overpayment or compliance issues. Exclusions mapping is a really good example. You see it third on this list. Fraud mapping and tracking. I'll actually go into a specific example about this as well to say if you have a provider data or exclusions mapping strategy in place, you're actually extremely likely to prevent false claims from going out the door and having to recover them later. That is where the industry is going for really good SIU teams. Similarly, license and credential mapping across states. So you know if somebody's license was revoked in Pennsylvania, they moved states, got a new license in New Jersey, and are now applying to be part of your network. Do you have a process to understand that? Outliers, upcoding, service profiles, any unusual patterns, doctor shopping, and duplicate payments, right? So data mining runway, if there's anything I want you all to take away from this webinar, the best SIU teams are incorporating this in each of these work streams and then deploying that data just to get smarter about the way they're monitoring. And so really just to have one quote on here, Healthcare IT News published this quote last year or 2 years ago, it's 2019 now, about connecting prepay and postpay. And so this is from a little bit of bias here from ProviderTrust. We believe in this concept strongly. So we are very much on board with the sense that if you can connect prepay and post-pay activity, you can you can block a lot of things out from going out the door in the first place to achieve payment integrity. And so the quote here, which we love, is traditionally employed post-payment recovery approaches to overpayment management can be augmented with prepayment solutions to achieve meaningful payment integrity. This is something that we just believe in wholeheartedly, that if you have your post-payment recovery approach and you're complementing that, not replacing, but complementing that with a prepayment approach, you can achieve, I keep saying achieve meaningful payment integrity. And so last poll question, and then we will get into a case study about how how a specific health plan that we worked with actually achieved payment integrity and kind of the before-after approach. We'll have one more poll question. So, has your health plan explored connecting post-pay monitoring with prepay analytics? So, I'm just really curious to hear, is this a total foreign concept to some people on the phone? Is this, I'm not sure, this kind of exists outside of me? It's yes, you're actively exploring, or yes, some different department is handling this, right? So I know this is going on, but this is totally falling outside of the scope of what I'm looking for. So super excited to see kind of where we land. I know this is where the industry is headed, but that doesn't necessarily mean everybody on this call has been privy to kind of exploring that so far. So again, we're at about 78% or so having voted. So we'll give it another second or two to make sure everybody gets their vote in. And a quick thank you for your participation too. These have been super highly engaged polls. So we're super glad you're staying on the phone, staying engaged. Thank you in advance. We will go ahead and close it out. And again, really interesting. So 19% of y'all on the phone have not explored this yet. 7% is yes, but a different department's handling. 22% is yes, you're actively exploring connecting post-pay monitoring with prepay analytics. And then 52% are not quite sure, which is awesome. Would encourage those 52% just to say, hey, might be time to ask a quick question, or feel free to share a slide or two from the webinar to say, hey, is anybody talking about this within your organization? Happy to share some case studies too to help prompt that discussion internally if it makes sense for y'all to pursue. So let's get into a quick case study. So as a baseline to anchor to, our philosophy when it comes to really accurate provider data is putting NPI at the core of your monitoring. And so what do I mean by that? It's to separate the person from the artifacts. So if you start with the person, right, and again, I'm using this in the sense of an individual provider. Things like federal and state exclusions are associated with a person, not necessarily an NPI number. State sanctions or disciplinary actions issued by licensing boards are associated with a person, not a thing or not an NPI number. An NPI is issued to a person, certainly a company as well, but a person in this case. Medicare opt-out is associated with a person. SSDMF, OFAC listing, things like that are associated with people. When to know the provider, so there are artifacts associated with providers. Things like credentials and certifications, any sort of licensure documentation, that is associated with an individual person, but it's really just a thing. So monitoring the person versus the thing is super important. And so here's an example of that, right? So the NPI number, here's a timeline of activity. The NPI number always with this provider stays consistent, but you'll see how some things change over time. So in June of 2016, there's an allegation of theft of money from a patient from a provider. 12 months pass. In June of 2017, the licensing board issues the administrative action against a person. Right? This is what we would call a sanction, right? It's some sort of disciplinary action. In July, so 1 month later in 2017, there's no defense by this person, so the board revokes the license. This is what we would call, again, knowing the person versus the artifact, this is what we would call the artifact, and there's license revocation. 7 months go by, and in January 2018, the OIG excludes the person because of their license revocation, right? It's an exclusion. So this is where you start to understand the difference between a sanction, a license, and an exclusion. In January of 2018, SAM excludes that person based on the OIG exclusion. So now there are multiple records of an exclusion on multiple sources. 5 months go by, this person changes their name, moves, and is issued a brand new license, right? So it's essentially new last name, they've moved states, and they have a new license, but the NPI number is the same. In June of 2018, 2 years later, this provider applies to be part of your provider network with a new name in a new state and with a new license, but the same NPI number. Do you catch it, right? This is a really interesting question, and I'll tell you why. You might look at this and be like, yeah, the NPI number hasn't changed, right? So of course we would catch it. The NPI number is the same. The reality is the vast majority of exclusions or licenses or sanctions don't actually include the provider's NPI number on it. They may include a name or an address or a date of birth or a social security number, but they largely don't include NPI. So actually, if you're counting on just looking at NPI at the primary source, you may very well miss this provider. So our philosophy before getting into the case study is that NPI is the core of everything. If you can map in various names, right, because people's names change, all current and former names of any providers, credentials, any licenses ever that have been associated with that person who has that NPI, right? So regardless of what states or what disciplines, any sort of provider directory updates, sanctions and exclusions, and then shared data, which again is not the purpose of today's call. We've done webinars in the past of how certain health plans are leveraging blockchain technology to actually share provider data. So when it's updated at one health plan, it gets automatically updated at another. That's another direction where this industry is looking to go. We will do more webinars on it, but it's not the purpose of today's talk, not the purpose of today's. That said, certainly felt like it was appropriate to include here, because once you get different data points on a provider, sharing that within different provider networks is certainly where the industry is heading. And so with that, here's a case study on connecting prepay and post-pay and how the best SIU teams are starting to think this way and start to drive their strategy this way. So here is just a sample, right? We partnered with a larger health plan in the Southeast to really build this out for them. But here's just a quick overview of data that we would get. Right, so in this case, we had demographic data, which includes from on a provider. We would have name, an internal or a unique ID specific to that health plan, an NPI or social security number, a billing address, a date of birth. We had their network status, so PAR or non-PAR, any medical license numbers that this organization had on file, the specific line of business associated with this provider, and then were they a physician or a hospital in terms of billing entity. And then claims, they gave us sort of full year 2017 claims amount. So what we did is then walk them through a decision tree that I'll walk you through. We started off with 320,000 records, which represented about $9.3 billion in claims. We determined that 320 very quickly was about 193,000 unique providers. Again, about $9.3 billion associated with almost 200,000 unique providers. We then looked at the providers that did not have an NPI versus the providers that did have an NPI. The vast majority of the providers in this case study, 175,000 providers, had an NPI number and represented 9.27 billion in claims. Within that 175,000 that had an NPI, 30,000 of those were facilities, which are the vast majority of that claims amount. And then 144,000 of them were individual physicians, which represented 1.46 billion in claims. Within that full 175, we then sort of started to run it through a data mapping screen and say, okay, based on all the data that you have in your provider data management system, let's run it against a grid and see what else is out there that you haven't caught. right? What's existing in these current provider directory files that you have not caught yet? And so we ended up catching about, a little over 1.5%, that about 3,000 flagged providers, which represented about 14 million in claims. And of those, about 416 of those were excluded providers. 1,600 of those were inactive NPIs. 911 were actually on the Medicare opt-out list. 36 of those were invalid NPIs, which was directly from this organization's file. So looking at the exclusions, because this is where this gets really interesting, that talking about NPI as the core. Those 416 excluded providers represented about 1.676 million in claims. Of that 416, 288 of those were current, 134 of those were reinstatements, and one of those was a waiver. And then looking at the 288 current exclusions that had somehow slipped between the cracks, 171 were primary source match, and then 117 were found with our augmented data. So when I say our augmented data, we actually take a primary source exclusion and we map on our end, we map an NPI to that. So if an NPI is not published at the primary source, we make sure we have that within our data to really make sure we're giving a holistic service. And so we're actually able to catch hundreds of exclusions that somehow fell through because of what's not actually published on a primary source. So in seeing this, this partner health plan then decided to say, okay, here's what we're missing from a post-pay environment. How do we actually take this and connect it to prepay? And so now what this plan is doing is they're continuing with their ongoing provider data monitoring on the back end, but they've taken whatever the status is of that monitoring and they've connected it to, at time of claim, screening instantly to say, before we even start the process of claims reimbursement, should this provider be paid based on any sort of data that we have within our grid before it ever goes out the door. And so using this sort of case study, they're actually able to block, in this case, they were able to block almost $14 million in claims from going out the door from what they were able to find in a prepay environment, and then started investigating from there. Think about that. That's a lot that an SIU team doesn't have to go and try to recover on a case-by-case basis within your management system. So you have all those hours back to the day, and that's what this health plan has been able to realize between connecting their prepay, their post-pay monitoring with their prepay analytics. And so just a quick example, it's really interesting when you look at things found by source. And so again, you'll all get the slides of this, but this is just to say that exclusion sources can be across the board from all kinds of different states. And then here's what I'm talking about. So here's specific examples of what we helped this health plan actually launch so they could block providers from submitting claims in a prepay environment versus trying to focus on post-pay and work on recovery. And so here's what the client gave us on the left. So Lawrence Feldman, who's a provider, there's a location address, a billing address, a date of birth, an NPI number, no social on this provider, and a 2017 claims paid amount, which is about $48,000 in claims. An exclusion was found, Maryland State Medicaid exclusion list. Lawrence Feldman, first and last name. Address was an address in Westminster, Maryland. So you'll notice right away, does not match the addresses that were on file. This person had moved. And the exclusion date, October 24th of 2015, right? Again, that's a date that's not found in the client's data. If you're not connecting your sort of data enhancement strategy in a post-pay environment to your prepay, you would never find this exclusion before you actually process the claim. Your SIU team would then find it on an investigation standpoint, have to kick off their recovery. What this client was able to do is to say, okay, because we have a data enhancement strategy, there's the Maryland state exclusion on the right with an augmented NPI number. And because that NPI number matches what the client gave us, they were able to identify and prevent that claim from going out the door before having to work on recovery on the back end. And just one more, again, it's a very similar story, but it's another specific example to say, here's another Houston, Texas provider on the left with a Pennsylvania state exclusion, but because there was a data enhancement strategy in the back end to augment primary source data with NPIs, we were able to, this health plan was able to block the claim from ever going out the door to prevent future recovery. And so key takeaways, and then we'll wrap up. So we have 5 for you today. So the first, internal collaboration and communication is key to building an effective SIU. A dynamic SIU starts with the right people and the right infrastructure. So for us, again, today we focused on the right infrastructure as a part 1 to this. There'll be a part 2, which is to focus on the right people and how do you recruit, retain, and engage the right investigative minds to build out your SIU framework that has a great culture and great engagement. Number 3 is aligning internally on a triaged SIU prioritization matrix with increased focus, efficiency, and measured results. 4 is connecting prepay analytics with post-pay ongoing network monitoring is a critical emerging trend in developing a dynamic SIU. And then 5 is leveraging NPI as the centerpiece of your ongoing network monitoring strategy is crucial to data integrity. And so right now we'll go ahead and open it up for questions if we've got any. Looks like we only have a few, but we're actually running a little tight on time. So for those that had submitted questions, rather than open it up now, I'll make sure to respond to you individually via email. Last couple things just about us, and then we'll wrap up here. Here's one slide that you'll get on ProviderTrust, sort of who we are and what we do. You'll get this as well as your CEU after the webinar today sometime. We work with health plans in a prepay and a post-pay environment. Just a quick splash of sort of how we partner with health plans, who we are and what we do. This is sort of our latest product innovation. So I talked a lot specifically about how to develop a dashboard for SIUs. We have a product called Dash that actually has an SIU dashboard component. Just again, a quick splash in terms of who we are, what we do, and how we actually partner with health plans is we don't solve everything that an SIU team is looking to or a compliance team is looking to, but we can certainly solve some of it. So if any of this is sort of struck a chord today, feel free to reach out. We'd be happy to connect. Again, just the last thing here, go ahead and connect with us any of the following ways. We do monthly webinars. So we do 2 webinars every month. One that's aimed at a more health plan audience and one that is aimed at a more provider organization audience. Certainly feel free to come to both. You can double up on CEUs if you need to. You can come to both and go to 2 webinars of ours a month, or you can kind of stay on your track and just continue on with continuing ed in the health plan segment.
Great, thanks so much, Dave, and thank you all for being here today. One note I want to say before you head out is that we originally promoted this webinar as a 30-minute webinar, but we wanted to make sure that we were very thorough and shared all the information that we could to give you the most value to your time. So I want you to know that we'll be making a quick revision to our CEU submission to the Compliance Certification Board. So originally it would have been for 1/2 of a CEU, but I will make that revision today. So be on the lookout. That will take some time for the CCB to get back with me on that revision, but that will be done today. So you will not receive your CEU this afternoon, just so we can make that quick change and make sure that you get the CEUs that you deserve for spending this time with us today. So with that, thank you so much for being here, and be on the lookout for those emails from me, and have a great rest of the week. Thanks.